So thanks for taking time out of your Tuesday evening. We're going to talk about pain management from a different perspective. This isn't going to be traditional pain management, which is just masking symptoms. It's going to be really understanding the root cause of what we're going to be focusing on today is osteoarthritis, but really understanding what osteoarthritis is and how you have the power to actually help your body heal and overcome this. Obviously, osteoarthritis can get to an advanced stage where more interventions are indicated, and we'll talk about some of those therapies that we can do. But the goal is prevention in pain management. I don't think we talk about that enough, and really that's what I want to focus on here. Sorry, we're still letting people in here, so
Oops, sorry guys. Okay,
can we? Yeah, there we go.
move it.
So, how many people out there are currently dealing with some kind of joint pain or joint stiffness? Just show me your raise of hands. I can see most of you on the camera there. So yeah, I mean, I think most of us are. I just turned 50 last year, and even before then, I'd say even in my mid to late 30s into my 40s, I experienced some kind of joint pain on some level. My left knee has always been bad. I used to lift stupid heavy weights. I was a wrestler. I used to play racquetball, mountain bike, tennis. And when I moved to Arizona, I started hiking a lot and my left knee kind of took the brunt of it, probably due to root cause, altered biomechanics, not paying attention to my form, not having a solid, strong quadriceps tendon, which could have eliminated some of this dysfunction. But I think it happens to all of us, and we're all looking for solutions to deal with this. And today we're going to go over some of those options. So a bit about my background. Most of you know me. There are a lot of new names on here that I don't know. So just some background. I'm a double board certified anesthesiologist and fellowship trained in interventional spine and pain management. I trained at the Cleveland Clinic. I'm originally from Ohio, so I did all my medical training there. And then after finishing at Cleveland Clinic, I did a year of private practice in Columbus and then moved out to sunny Arizona where I practice traditional pain management. And traditional pain management involves, doing injections, doing nerve blocks, and doing these modalities to really mask pain. None of our interventions in pain management are geared towards treating the underlying root cause. A lot of times we understand what the root cause is, but with traditional pain management, we just shut those pain signals off and really don't help the body heal itself. And there is value in that, especially when you're dealing with severe chronic pain or severe acute pain. It's important to control that pain so then you can do what's really going to help you heal, which is most of the time is physical therapy and really working on your body mechanics. So I practiced with a large anesthesia and pain group here in the Valley from 2008 to 2021. And in 2021, I started my own practice. And when I started my own practice, I really wanted it to be about root cause medicine, getting to the underlying cause of what the pain is, and coming up with solutions that are longer lasting than what I'd been practicing for 16, 17 years prior to that time. So that's what this talk is going to be about, and that's what my practice has evolved into. So with traditional pain management, like I said, it's more of a sick care system. I think that's what the US American society has deemed our healthcare system more of a sick care system. You go to the doctor when you're feeling ill, you go to the doctor when you have a sick complaint, you go to the doctor when you have pain. A lot of times it's almost too late by the time you get there. So you're dealing with an issue that has already manifested. And so our society and our system is set up to manage you when you're sick. There's a group of doctors across the country. I call us the medical disruptors, and we're focusing more on well care. So I like to see people before they have problems. Why would someone decide to come see someone like me? Well, let's say you have some minor joint pain. You wake up in the morning, you got some back stiffness, you got some knee stiffness, you got some neck stiffness. It's minor. You don't need to take any medications for it, but it's there. I'm starting to see a lot of people between the ages of 25 to 55 who have these minor joint pains, and they're starting to come to see me to learn about prevention and what they can do to prevent this from turning into a chronic condition. I tell people that what you do now, the choices you make, the lifestyle choices, the foods you eat, your body movements, your exercise, activity levels, your state of mind, your happiness will affect where you are over the next several decades. So now is the time to start to create that foundation.
So I have a question.
Yeah.
So what about this new way of how you are treating patients? What like drew you to it compared to what you were doing in the past?
Yeah, well, after doing traditional pain management for about 10 years, I went to a conference in 2017 where I learned about regenerative medicine. This is where we use the body's own healing ability. So our body has this amazing capacity to heal itself. For example, you break your arm, you cast it, it automatically fuses together. There's no other intervention involved. There's no surgery necessarily. It's just casting it. So we have this innate ability for our bodies to heal. Well, regenerative medicine harnesses that ability. We can concentrate growth factors. We can concentrate the cells in our body and put those into areas of injury or even areas of minor disease like minor osteoarthritis, and it can cause the body to rebuild itself. So once I learned about that, it really opened my eyes to a whole new possibility of what we can do with medicine and we can do with healing the body. So instead of just masking pain, which is what I had done for 10 years of my life, I got turned on to this way of thinking where we can actually use the body to heal our body. So it's beyond just masking the symptoms, beyond a cortisone shot that gives you 6 months of relief, maybe if you're lucky. But at what cost? It's at that same conference I learned how serious these cortisone injections can be. They're what we call chondrotoxic or cytotoxic, which means that they're toxic to the cells in the area where they're injected. So, for example, if we do trigger point injections with steroids, we know it can destroy the fat and cause necrosis, and it can even destroy the muscle tissue. Same thing, we put it in joints. It can cause breakdown of the cartilage. I tell people our bodies are in this state of catabolism, which is breakdown, versus anabolism, which is building back up. And so think about a high school athlete, a 14-year-old, 15-year-old basketball player, football player. These guys beat up their bodies. They're jumping up and down, lifting heavy weights, taking hard hits. Well, guess what happens to their joints? They regenerate, they rebuild, they recover. You do that same thing at 50, your joints are not going to recover nearly as fast. In fact, you'll probably accelerate degeneration and osteoarthritis. And why is that? It's because of the growth factors and the way our bodies are set up at that young age. We have a surplus of these growth factors so they can rebuild and repair cartilage. As we get older, unfortunately, our body doesn't do that on its own. But now we have a way where we can basically tilt the scales towards anabolism or building back up our tissues that are breaking down.
It's fascinating.
That's a long-winded answer to your question. Um, Again, sick care versus well care. We spend a lot of our money in the US on sick care. Again, we treat high blood pressure with a blood pressure medication. It's doing nothing to treat the underlying cause. We just get you in this parameter where the numbers are quote unquote normal. Same thing with cholesterol levels, right? You take a statin, it gets your numbers in a certain level, but those same people are still dying of heart attacks and strokes. So maybe we're prolonging the inevitable, but we're not reversing the
We're not
inevitable.
fixing the
We're not
problem.
fixing the problem. Exactly. So again, most of us wake up. I mean, every morning I wake up with a little back stiffness, a little neck stiffness. I've got some stenosis in my neck, again, from lifting stupid heavy weights, not having someone, a good physical therapist or a good personal trainer, guide me in how to lift weights appropriately. When I was younger, I'd just go to the gym and watch what other people were doing and try to imitate them. Oh, like, oh, okay, those are the exercises I'm going to do because that person looks that way. And that's my goal, is to get those muscles developed. So not paying attention to form, I created stenosis on the right side. So as far as our osteoarthritis is concerned, by definition, osteoarthritis is inflammation of a joint. It occurs when the cartilage inside the joint starts to break down. Okay. And there have been studies that have shown that you can have complete breakdown of cartilage and not have any pain. So it's more complex than just losing cartilage. It's also the mechanics of the joint. And that's where the physical therapy team comes into play. And that's where really focusing on nutrition and diet comes into play as well. Because we can talk about anti-inflammatory foods, which we'll get into in a little bit, but we're also going to talk about body mechanics and how someone with bone-on-bone osteoarthritis, I see this all the time, they've got no pain in that particular knee, but their other knee, which has moderate osteoarthritis, has significant pain. So what's going on there? And a lot of times that's just a change in body mechanics. But in a nutshell, osteoarthritis is wear and tear of your joints, which leads to inflammation and causes pain.
So does osteoarthritis happen at a specific age? Is this something, do young people experience osteoarthritis, or is this just people as we age, we can get it?
That's a great question. So, I mean, there's rheumatoid arthritis, which is where our immune systems attack our cartilage tissue, basically. They attack a certain part of our cartilage. And over time, it can cause breakdown of those tissues, which can lead to osteoarthritis as well and breakdown of the joint. But specifically with osteoarthritis, most people in their younger years have the ability to regenerate their cells.
Mm.
Most of the nutrients that feed the cartilage come through the bone from the bone marrow. And when we're younger, we have a robust amount of nutrients and growth factors that can feed that cartilage and keep it healthy. But really, it depends on how active you are. How much are you loading the joints? Again, that's catabolism. The more you load the joints, the more the tissue breaks down. But if you don't have enough of the anabolic forces or the buildup forces, then the breakdown is going to take over, and that's when you develop osteoarthritis. I got diagnosed with osteoarthritis in my knee in 2008. So that's when I had to give up playing racquetball
In
and
your 30s.
in my 30s. So I was 34 at the
Okay.
time. So it can happen in our 20s and 30s. I've got 40-year-old patients who are having knee replacements. Or who've had knee replacements for advanced osteoarthritis. So you can get some congenital or you're born with certain defects in your joints that can accelerate osteoarthritis. But for most people, it's wear and tear over time, right? So the more active you are, the more unhealthy you are, the more sedentary you are, even, the more those tissues can break down. So there is a fine balance between activity and also being sedentary. So you want to find your particular level, which is where personalized medicine comes in. With the sick care model, you have to fit in certain parameters. It's one size fits all.
Right.
With this wellness model, it's really individualized and tailored towards each individual person. So some of the symptoms of osteoarthritis are pain in the joint, moving, when you move your joint, there's pain. When you weight bear, there's pain, stiffness, especially in the morning. So with our joints, when we're sleeping, we're not moving them all night long unless you have really bad restless leg syndrome. So otherwise, at nighttime, the joints kind of stiffen up. They're not lubricated. As the day goes on, we move our joints and they get better due to the lubrication. We produce this natural fluid in our joints, synovial fluid, which acts as a natural lubricant and loosens up the joint. Overnight, we tend to produce less of that when the joints are not moving. Um, Cracking, popping sounds, sometimes swelling in the joints. Can you?
Limited movement.
Okay. Yeah. And then of course limited movement as well. Um, so these are the first signs that you're going to experience, and that's usually what draws you into seeking some kind of medical attention or even reaching for the bottle of Advil. And I can tell you that recent studies have shown that people who take anti-inflammatory drugs have an accelerated rate of osteoarthritis.
Why is that?
I'm going to explain that to you. So, number one, they mask the symptoms, right? So you stop having that feedback loop, your body telling you, "Hey, I got a problem here," right? So you pop the Advil, the inflammation goes down, and you feel better, right? But the problem is, while you're masking the symptoms, the cartilage continues to break down and gets worse. So over years, people who take Advil or NSAIDs ibuprofen regularly will have accelerated breakdown of their tissues, right? Also, Advil, with the group of medications called NSAIDs, non-steroidal anti-inflammatories. These include Celebrex, meloxicam, diclofenac, ibuprofen, naproxen, which is Aleve. Those can affect your gut health as well. And so everything really comes from the gut. Our gut's probably our most important organ. organ system in terms of our health. And so when we consume these anti-inflammatories, we disrupt the ability of the gut to absorb nutrients. And so then the nutrients don't get delivered into our femur bones and our bone marrow where they get delivered to the cartilage to rebuild these tissues. So I think it's a multifactorial effect. It's
Yeah.
not only just anti-inflammatory masking pain, and you cause the situation to worsen, and you cause the osteoarthritis to get worse.
Okay.
Mhm.
Interesting.
So we've talked a lot about traditional pain management. It's interesting. A lot of what I do isn't covered by insurance, and I know that can be challenging for people. But what is covered by insurance are opioids. I could literally, you could come to see me for knee pain. I could write a prescription for an opioid. Your insurance is going to cover that right away, like no questions asked. You show up at the pharmacy, you can get an opioid, which is powerfully addictive, which will do nothing to treat the underlying issue, will do nothing to prevent this issue from coming back, but that's what they'll cover. Same thing for steroids as well. I do believe there is a place for steroids, cortisone, if you will, especially when people are absolutely miserable. Cortisone can reduce pain. So I tell patients it's always about risk versus benefit. So we have to sit down and weigh those options together. I have people when I go over the risk versus benefits, some opt for the cortisone injection because they can't function, they can't do their daily activities, and they've got a life to live. Other people will say, "Hey, look, I can get by and I don't want to break down my tissue, so let's talk about these other options. I want to choose the marathon versus the sprint." So,
So you went over the symptoms and you went over, how this can be something that people either have a genetic precursor precursor to, or it's just wear and tear in your joints. But so once somebody gets diagnosed, let's just say they start, seeing signs and symptoms.
mhm.
So I have two questions. The first question is, what is it too early to ever go and see a doctor for these symptoms? And then the second question is, somebody is diagnosed with osteoarthritis, are there solutions? Is this something that they're going to have to live with the rest of their life, or can they reverse it?
That's a great question. So let's talk about that. Um, so let's say, for example, I have no osteoarthritis in my right knee. I'll use myself as an example because I think that's what I can relate to the most. I mean, I've seen a lot of people, but we can all relate to ourselves the most. My right knee has no cartilage loss whatsoever, even after 50 years of living on planet Earth, living a relatively active and healthy lifestyle. Um, my left knee, on the other hand, is pretty beat up. So under my kneecap, I have no cartilage. It's completely gone. So that's what we call grade 4. Grade 4 is where it's bone on bone. I do have cartilage on the inside of my knee, on the outside of my knee, so my knee functions normally. Um, so let's talk about my right knee. So what can I do with that, right? So it's healthy. I want to keep it healthy. So number one, food. I tell everyone if we have a new administration coming in, if we can do anything with our healthcare system, it would be to incorporate nutrition as foundational health. I think that's the most important thing. Food is medicine. We really need to clean up our food supply,
Yeah.
get access to healthy foods for everyone.
Better options.
Better options, yeah, because we've got a group of people who are fighting to take the toxins out of our food. These are toxins that are not found in any other food supply anywhere else in the world except for the US. The rest of the world has banned these substances, these preservatives, these dyes, these artificial ingredients because they're toxic, right? So if we can eliminate those, we can start with a foundation of health. I think that's the most important thing. So for your joint health in particular, anti-inflammatory diet is incredibly important. This is avoiding processed foods, avoiding refined sugars, eating healthy fats, focusing on whole foods, and again, minimally processed foods. I think that's the most important thing. What else can we do? For my right knee, what do I do besides diet? Physical therapy exercises, strengthen the entire unit, functional unit of the joint. So that includes having a solid, strong quadriceps muscle, supporting the ligaments around it through exercise, having appropriate flexibility, but not over flexibility. All those things help keep a joint healthy. There's also regenerative medicine. We'll get into this in a little bit more.
Mhm.
But one thing I do is I put platelet-rich plasma into my healthy knee
Mhm.
because we know from level one studies, which are the highest level studies in medicine, that PRP and the growth factors in your plasma can prevent the breakdown of cartilage for up to a year or two. It's remarkable. So this is one of the things that can tilt the scales towards anabolism. You're not necessarily going to regrow cartilage, but at least maintain what you have. So you're talking about the bad knee now. You ask, what do we do about that? Can I regrow the cartilage? Can I reverse the damage that's been done? We're learning more and more about these stem cell therapies. Right now in the U.S., you can't really do them. They're only available through certain studies, research studies, through usually large universities. But there are clinics across the world, several in Mexico. Some are better than others. And they are showing promise with actually regenerating cartilage tissue. So that's one option you can do for more advanced disease. But there comes a point, for example, and under my kneecap, it's advanced osteoarthritis. There's no cartilage that's going to regrow there yet. We don't have that available to us.
So you're
Mm.
saying that you don't, this isn't something that you just have to live with for the rest of your life.
As
Like
far as
there are options.
There are options to manage.
Osteoarthritis.
Oh, for sure. There are options to manage.
Okay.
Yeah, exactly. For example, I've done PRP in my left knee, and my left knee no longer bothers me.
Mhm.
I did four treatments over the course of 3 years. And March 31st, 2025 will be 2 years since my last treatment, and my knee is still doing phenomenally well. In terms of function, in terms of pain, I haven't got follow-up MRIs to see how the cartilage is, but I feel good and I'm able to function. And it's something I'm going to continue doing until we have better tools available to us. And maybe someday we'll have something that can actually regrow cartilage.
So some of the things that we can do at home in order to maybe help prevent the progression of
Yeah.
osteoarthritis and also help with symptoms, like if we are experiencing the symptoms that you talked about.
Mhm.
So what is that?
First of all, food, foundation, anti-inflammatory diet, really cleaning up your food. That's the most important thing. Nikki and I, we practice the 80-20 rule. So 80% of the time we're really eating clean. Throughout the day, I like to do intermittent fasting too, which has many benefits. If you can do that, that's great. If not, you have to listen to your body. But make sure the foods you're putting into your body are whole foods, not processed, low in sugar, low in refined carbs. Um, that's one of the most important things you can do.
And even when you say the 80-20, I want to just kind of preface this. So even in the 20%, when we are going to a restaurant and we are eating out, we are still also being mindful about the foods that we are choosing. We're
Absolutely.
not choosing on the weekends, we're not running to McDonald's to go grab, some fries and, a hamburger. We are trying to choose restaurants that are good and we enjoy, but also we know that the foods are prepared a certain way, or we really try and stick to when we are eating out, we skip the bread basket. We go more towards protein, make sure we're eating a vegetable. A lot of the times we're skipping dessert. Not all the times, there are occasions where we do it, but I think, just being mindful of that 20%, not kind of going crazy and
Exactly.
and eating,
Overindulging.
overindulging. And we really focus even at home, not buying a lot of actually we don't really buy any processed
Mm-mm.
food. We really focus on whole foods that we can, make and actually, enjoy it.
Exactly.
Mm-hmm.
Yeah. I think
Mm-hmm.
that's incredibly important there. And one thing when we go out to eat, it's really hard to find healthy, clean foods when you're
Mm-hmm.
going out to eat. I mean, most of our food is cooked in seed oils that we have learned are really pro-inflammatory. They've got the bad omegas in them, and when they're heated, they create free radicals that can really damage our bodies and create inflammation and create disease. So, we found some restaurants that don't use those seed oils. It's hard though because seed oils are dirt cheap, and so most restaurants are using those types of oils to cook their food in. Unfortunately, it can take a toll on the body and increase inflammation. So, if I got a whole program I go into in a lot of detail in my practice. If you're interested in that, I can go over all the seed oils and what to eat and what to say at restaurants when you go out to eat. I mean, just ask them to, if they can cook in beef tallow or another option, olive oil, avocado oil,
Butter, even butter
butter,
is
grass-fed butter,
and
exactly, for sure. So,
we also have programs available at the clinic that we can kind of enroll you in um, that go over the anti-inflammatory diet in more depth.
mhm.
So it's really interactive and it just guides you through the entire process. So if you're ever interested in learning more and you want to, I mean, we have different programs for weight loss, anti-inflammatory, heart health, gut health. I mean, there's so many. And Dr. Goyle, if you're interested in gaining that knowledge, he can help you.
And it's all through food,
Yeah.
which is amazing. I mean, like I said, food is medicine. It's the most important aspect of this entire talk. It's the most important aspect of your health. So you want to start there.
One of the things, so give us a list of some whole foods that are beneficial and are, optimal for or helpful for reducing inflammation.
That's a great question. So, I would start with like your leafy green vegetables. They're full of antioxidants, they're full of minerals, vitamins. So this would be like your spinach. This would be um, like
Fruits, vegetables, broccoli,
all
asparagus.
of that stuff. Yeah,
We
exactly.
always say, like, whenever going grocery shopping, we shop the perimeter of the grocery store. We really stay out of the aisles because that's where you tend to kind of get in
All the
trouble.
boxes.
If you're cooking, olive oil, avocado oil, those are the only ones. We never cook, like, actually heat olive oil in the pan. And you can explain why, but we only use avocado oil and then olive oils for all of our marinades, salad dressing, things like that. But those are the only things. And then, of course, grass-fed butter.
Well, olive oil has a lower heat index than avocado oil. What that means is you can heat avocado oil up to a high degree of temperature, and it's not gonna basically change the molecular structure of the avocado oil to create chemicals that can be harmful for you. Olive oil has a relatively high heat index, but if you go too high, it can actually turn into some bad chemicals that can increase inflammation and increase risk of disease. So other foods are like ginger. Your fish is like salmon is rich in omega threes. All those can potentially have an anti-inflammatory effect. And we have a whole anti-inflammatory diet. Nikki created it
Mhm.
based on a lot of good research, and it's simple, easy recipes, and can really make a profound difference in people's lives. I'll give you an example. I had a woman come to see me from Washington, D.C. for PRP, which is platelet-rich plasma treatment. And I put all my PRP patients, they were regenerative medicine patients, on an anti-inflammatory diet, usually 2 to 4 weeks before we actually draw their blood, because we want to keep the plasma as healthy as possible. Well, because she lived in Washington, D.C., she she came to see me, then she flew back. I sent her everything. And she's like, hey, I want to do this anti-inflammatory diet for 2 months before I come back out and do my plasma procedure. So she did. And this was in, I think, 2022, but she saw me in August and then did the anti-inflammatory diet, ended up losing 30 to 40 pounds to the point where her knee pain went away. So she was seeing me for her both hips and both knees. And so she lost weight, felt amazing, ended up coming out in December. We still treated her hips and her knees because we talked about the preventive nature of PRP. And even to this day, so we're talking almost it'll be 3 years this summer since she first met me. Every now and again, I'll get an email from her, and she and her family are still on the anti-inflammatory diet and incorporating this lifestyle.
Mhm.
And the pain has been great. And she's like, my husband's lost weight. I've got family members who are eating these anti-inflammatory foods. She actually emailed me and said, PRP were great. Your wife's recipes were life-changing. And really, food is medicine. I think that's the most impactful thing we can do.
And so a lot of the times there is a question about pasta. People like pasta. And really what I have done, you guys can all, I'll put in the chat at the end. I have an Instagram page that I've dedicated to anti-inflammatory diet and kind of showing you easy ways to eat healthy at home. And I love food. I've always loved food. I love to cook. And what I have found is substitutions are key whenever you're trying to eat healthy. So finding a better option for the foods you love. So when it comes to pasta, I have Hashimoto's, so which can turn into hypothyroidism. So I really try and stay away from gluten as much as possible. So a couple of my favorites that don't taste like gluten-free pasta are Jovial. That's a great brand. They have a brown rice or a cassava flour pasta. Um, and I think that's the only one that I actually use is Jovial. All the other ones don't really taste like it. And
Or
yeah,
if you can, import your flour from Italy, like Rob is mentioning here, mill your own flour and make
yeah,
your own pasta. I mean, that would be the ideal situation.
yeah.
With our busy lifestyles, it's just not in the cards right now, but someday maybe. I mean, well,
Well, I do import, I do buy imported flour. So if I am gonna make a bread, at home, or if I'm making any type of, baked goods, there is a flour that I love. I can, put this on my social media, can share it with you guys, but it's an organic wheat flour that comes over from France, and I had a doctor recommend it to me years back, and it's supposed to be a lot better than the options that we have in the United States. So if you are going to cook with something, either do what Rob is doing, mill your own, or you can buy the imported flours. So, and we'll give you all this information. We're recording this whole entire presentation. So you guys will send it to you tomorrow. And if you guys want to go back and revisit anything, you can. So a lot of the questions that I've seen are, what are supplements for joint health? What should we all be taking at home to either if we in a preventative fashion, or if somebody has already experienced symptoms and they want to feel better.
Yeah, so I'm a big supplement guy. I mean, if you saw how many supplements I took a day,
Mhm.
you'd think I was got some kind of mental issues, which I
He
probably
takes a
do.
lot.
I take a lot of supplements. But part of the reason I do that is because I do intermittent fasting. So I'm only eating in a certain window, and I can't guarantee I'm going to get all the nutrients I need during that time. So I think I just have to eat a whole grocery store to really get all the nutrients I need. So a couple of supplements I'm a big fan of that have some data to support their benefit, especially with joint health. Glucosamine and chondroitin. That's a supplement that most people have heard of, glucosamine. It helps lubricate the joint, and it might help support cartilage regeneration. Again, when you consume it, it gets into the bloodstream, it gets into the bone marrow, and ideally, it's going to feed those cartilage cells to help them be healthier. Same thing with omega-3 fatty acids. We know that they have a profound anti-inflammatory effect in the body. SPM actives is a specific part of the omega-3 that has a profound anti-inflammatory effect. And studies have shown just taking that is actually more effective than some of the anti-inflammatory drugs without any of the horrible, harmful side effects. So that's something I can talk to you about as well. So that's SPM actives. Turmeric and curcumin, that's the yellow powder. It's an Indian spice that's become very popular, but that has natural anti-inflammatory, antioxidant effects too. We typically mix it with some black pepper because there's a bioperine inside black pepper, which actually helps us absorb the turmeric and curcumin. So if you take curcumin by itself or turmeric by itself, you may not get the bioavailability, meaning that it won't get into the bloodstream and have an effect in the body. So you want to make sure that if you are taking those supplements, that they're in an active form, or they're mixed with the black pepper compound. Vitamin D3, K2, calcium, magnesium, All of these supplements work together to help to support healthy bone health, to promote healthy calcium balance in our body, and then also support cartilage and muscle health as well. So all those things come together. Those are just a handful. There are a few others. Boswellia is a compound that's derived from an African tree bark that has the ability not only to reduce some inflammation in the joints, but it can also help cartilage stay healthy, if you will. Tart cherry, same thing. That has a positive effect on our joint cartilage and
And
joint
can
health.
help you sleep.
And it can help you sleep. That's a benefit too. So that
We
may,
drink tart cherry juice every night
well, you
before we,
do.
well, I
Yeah.
do
Yeah.
every night before I go to bed.
Hmm.
And it really helps me
Yeah.
sleep.
Yeah.
We had a question about CBD.
Hmm.
Somebody was asking if CBD can be effective in osteoarthritis.
Yeah.
So, I mean, if you want to talk
For
about,
sure.
we have a wellness formula that
Yeah.
has CBD and has also some anti-inflammatory ingredients. It's a gummy, so you
Hmm.
don't, if you don't like taking pills, it's a
Hmm.
little bit easier. It still kind of has a funky taste because of the CBD and there's apple cider vinegar, but it's definitely easier if you can't swallow pills.
Yeah, and it's a fantastic. So CBD has a natural anti-inflammatory effect. We're learning that some of the pathways that it activates in our body actually have an analgesic effect, which means that it can actually relieve pain too. So I think you get a lot of bang for your buck with CBD as long as it's a high quality, well-prepared CBD. And so there are certain things you can look for, like CGMP certification, third-party testing.
Really,
So that, yeah, that's how you tell if it's actually a legitimate brand. But
even FDA regulated
mhm,
facility, like
yeah.
all of any of the supplements that are at the clinic,
Hmm.
we really are strict about anything that we either, refer or I think
Promote.
promote,
Yeah.
excuse me, or prescribe to clients.
Mhm.
And you always want to look for CGMP and FDA regulated products just to make sure that they're safe and that they do have the ingredients that they say is on the bottle.
Mhm. Um, so there's a question that says, do we have an anti-inflammatory drink mix? Nope, but I think we're going to be working on one. I
Yeah.
think that that would be a fantastic way, especially because if you can't swallow tablets, the challenge is going to be to get it to taste good. So getting back to the gummies, so our gummies have CBD. They've got apigenin, fisetin, and spermidine. These three compounds have some pretty amazing properties when they're ingested in the body.
Mhm.
They get rid of our dead cells, or what we call senescent cells. So our cells are constantly dying and turning over every single day. And some of the dead cells get stuck in our body and they can actually clog our lymphatic system and lead to disease. Well, these three compounds help eliminate those dead cells. They've been shown in multiple studies to be effective in doing that. We also added apple cider vinegar, which has an anti-inflammatory effect, but it's also incredibly good for gut health. And like I said, getting back to our original or earlier in the conversation, gut health is probably the most important aspect of inflammation. So keeping a healthy gut can lower overall inflammation throughout the body. Um, Tart cherry supplements, I think, are great. I actually have a joint collagen formula at the clinic that I usually refer to clients, especially if they have joint issues or if they want something more preventive. And it's got the tart cherry extract in it. So,
Just stay, I would say, and please tell me if you agree with this, but I would say stay away from the concentrate, that you want to look for pure tart cherry
yeah.
juice. I purchased both. I've done the concentrate and it just wasn't the same. It was on sale. And so I thought, oh, I'm just going to save some money and buy this, a different brand. And it was not the same. I found that the pure tart cherry juice is better and more effective if you're using it for sleep, which is what I'm using it for.
Plus, a lot of times concentrate, they add a lot of chemicals to actually extract the tart cherry itself. And so that process can actually diminish its effectiveness in the body. So, and cause some harm and create inflammation. So it may do the opposite.
And going back to the anti-inflammatory drink mix, again, I'll share my Instagram with you guys. I do have a drink mix that I make, fairly regularly. It's fresh turmeric. I put in a little bit of garlic. I know that sounds gross, but it's actually really beneficial for your body. Ginger, I do water, so I do like filtered water or a spring water, and then a little bit of black pepper, put it in our Vitamix, grind it down, and then I put it through a strainer and drink that. And I have to say, you feel when you drink it, you feel really good.
I forgot it. You haven't made it in so
I
long.
haven't made
I
it in a
forgot it. I
long
actually
time.
forgot about it.
Yeah.
So, yeah. So we do have an anti-inflammatory
Yeah,
drink.
it's
So,
good.
but we might create one that's more accessible to people, but we can give you
Yeah.
the recipe for that because it's
It's
easy to
really
make. Yeah.
easy. Yeah. Oh, and I put lemon in there. So I take
Mhm.
the lemon and I take the pulp off the rind and I put that in there and blend it all up. So it's really good. It's, going to help boost your immune system. It'll help, reduce inflammation, and
It's
it's
good for
really
gut
good for
health.
your gut.
Yep.
Yeah.
So other things you can do at home for joint health is move. I tell people God made us with joints so we can move. Otherwise, we would have been stick figures, right? So our spine has joints. Every part of our body has a joint. And so it's important to move these joints. And I think that's where yoga comes into play, or just going to see a good physical therapist or a personal trainer who understands body mechanics, and just get a regimen that you can do. A short walk, that gets the blood flowing, that gets your joints moving. All these things are simple things you can do at home on a daily basis to keep your joints healthy. Heat and cold therapy. So a lot of people ask me about heat and cold therapy. So as far as heat versus cold, typically what I recommend people do is first thing in the morning, heat is actually beneficial because if you wake up with stiff joints, heat can increase blood flow and decrease the stiffness and get you moving, right? I know a lot of people cold plunge in the morning first thing. There's a lot of incredible benefit for that too. That has a powerful anti-inflammatory effect, but you do want to train your body for that. Okay. That's something you don't want to just start doing off the bat. You want to maybe start at like 80 degrees, work down to 70,
Would you
then
recommend
60.
starting with maybe a cold
Yeah, just start
shower?
with a cold shower or even a lukewarm shower. I tried this. I'm not a fan. I know there's
You can't
benefits
do
from it. I'm just not there yet. Someday I do want to have an ice bath outside next to a sauna, and I'm going to be doing those back and forth or whatever. There's some protocols you can follow for that. We can save that for another talk. But heat in the morning typically, and then ice as needed. Ice does reduce blood flow, and it causes vasoconstriction. So ice is good for more acute pain. It can reduce swelling. I'd tell people, look, if you've sprained your ankle, the old mnemonic rice, rest, ice, cold, and elevation, or uh, using that method, it actually impedes healing because the inflammation you have after an injury actually is really good for you. That's what summons the stem cells to come to the area, causes the platelets to open up and release growth factors and stimulate healing. So cold with caution. That's my advice. Unless you're going through a specific physical therapy program, then the physical therapist will guide you through heat and ice regimen that's appropriate for you. So let's see, a couple of questions here. There's a couple of questions that came up. See, no, hang on. Let me see it. Uh, Oh, how many minutes of joint movement? 10 to 15 minutes every morning, I think is a good place to start. And then, as you progress and you say, oh, well, 10 to 15 minutes isn't enough, you'll want to do more. So, and this will lead into the next thing when I talk about meditation, but 10 to 15 minutes to start. Cryogenics, I'm not sure if you mean like the uh, the cold chamber. What's that?
Yeah.
Yeah,
Cryo
the
chambers.
cryo chambers.
Yeah.
So, I haven't seen any good data to support that. I think the good data really is in doing cold plunges, so full body immersion. I think with the cryotherapy, I tried it. I did 20 sessions. I didn't notice any benefits
I
whatsoever.
did it as well.
It didn't really do
Just
anything
didn't
for
like it.
me.
Yeah.
I think that's more of a fad than anything. I would say if you're going to do something in the cold, train your body to undergo cold plunging because we know we've got hundreds of published studies that show there's benefit with that. So another thing is mindful relaxation. So one of the things I'm really into is meditation. I've been practicing for several years. I started actually in high school, didn't know what I was doing, and would dabble here and there throughout my 20s and 30s. But in my 40s is when I really started getting into medication. And over the last I'm on like 750 days straight of meditating now without missing one day. I started off with like 5 to 10 minutes, and now it's progressed to 20 to 30 minutes every day. And when I have time, I'll do a full hour. So relating that to the joint, the joint movement, start off with like 5 or 10 minutes and work your way up to whatever works for your schedule. But mindfulness, I think, is incredibly important. Reducing our stress, reducing our cortisol, increasing our parasympathetic tone can be really beneficial for our overall health, overall well-being, and for a reduction in inflammation.
And we have a question regarding sleep
Mhm,
because I mean, sleep is really important when it
mhm.
comes to pain and,
Yeah.
even allowing your body time to heal because
Mhm,
that's when our body's regenerating at
mhm.
night. What are things if somebody's only getting 4 hours of sleep per night? What are
You need to find the underlying cause. That's the first thing I'm going to tell you to do. So it might be, I mean, 4 hours is less than 4 hours of sleep. That's just, we know from a lot of data that that's just not healthy. Even if you're functioning on that, it's still not, you're not giving your body adequate time to repair and heal. So things are going to be breaking down and not repairing themselves. So I would definitely maybe see a sleep physician to get to the underlying cause. It could be sleep apnea. It could be something in your lifestyle. If you're drinking coffee or caffeine, you want to stop that well before. Try not eating 2 to 4 hours before you go to bed, because if you eat too close to bedtime, you're digesting all night long. It's going to keep you up. Um, so there's a lot of factors that could be
Mhm.
influencing that. So, I mean, but if it's less than 4 hours, that I would say is pretty that's borderline, on the disease state. So that's where your body's going to be, instead of healthy and at ease, it's going to be in dis-ease. So this is where you'll want to see a sleep medicine physician, and really, you're gonna need to do something more than just take your supplements.
And Dr. Goyle really helped me personally with this because I had really bad sleep patterns when we first met. And I ended up going to see a sleep doctor and found out that I have like a low grade sleep apnea. It's called hypopnea. And I got one of those sleep machines and it changed my life. And so
And
I,
mine too.
yeah, and his too.
This She would toss and turn
Yeah.
all night long, to the point where, like, so I've got sleep apnea. I've been wearing a CPAP. I can put that thing on and I sleep really well, especially when we first met. But then like when we got married, she would just toss and turn
Mhm.
all night long, and it would wake me up. And I'd ask her, "Hey, are you okay? Are you okay? Like, you're tossing and turning." And then she'd get mad at me for waking her up. I'm like, "But you're not sleeping. You're tossing and turning all night long." And
Mhm.
so she's like, "You got a problem." So anyway, this is a real story. So she's like, "You need to see your sleep doctor." So I went to the sleep doctor. She came with me, and I was describing what was happening. And Dr. Patel, he's become a really good friend of ours. He's
That's
like,
fantastic.
"Hold on a second. Let me talk to Nikki for a second." And then he started asking her questions, and he's like, "I think you need to come see me." And I was like, "Yeah, because it's not me. I sleep great. You just keep me up all night." But anyway, sorry, a little aside there. But I think it's really important to get to the underlying cause of all this stuff. The drugs that are out there I think are terrible. People are taking Ambien, and unfortunately, like, I learned this from my sleep medicine doctor buddy. He's just like, people who take Ambien aren't in a state of restful sleep. They actually get up, they'll sleep drive, they'll sleep cook, they'll sleep eat, because they're not really sleeping. So that's pretty scary. I had one experience with that in Columbus during my first year of private practice, where a woman was a patient of mine. I didn't prescribe her Ambien, but she was on Ambien. And I mean, this was in 2007 or 2008 when I was still in Columbus, Ohio. But it was like on the news, the local news, like she was cruising down the highway like 90 miles per hour. And she's like in her 70s or 80s, in her nightgown, completely asleep, just booking down the highway. Police cars everywhere, trying to pull her over. Finally got her to stop. When she got pulled over, she was almost catatonic, and
Wow.
they attributed it to her Ambien. So, because
Wow.
there are cases of people sleep driving. So anyway,
Wow.
so my advice is to see a sleep medicine specialist and really get to the underlying cause. Healthy weight's incredibly important, especially now that we've learned all about these peptides that have come out, semaglutide, tirzepatide. There's also some newer peptides that are coming out that are showing even better promise than even tirzepatide, but they can be an adjunct to weight loss. I still think the best way to keep a healthy weight is through diet and exercise.
Mhm.
Really, that's the foundation. That's where you're going to have the longevity. these peptide shots, these fad diets, if you will, they're all short-lived. As soon as you stop them, the weight comes right back on. So that's why we like to focus on healthy food choices.
Yeah.
It's not a diet. I call it an anti-inflammatory diet for lack of a better term, but
It's a way of life, a way of eating.
yeah,
Yeah.
it's just healthy food choices.
Hmm.
It's just
Hmm.
that's what it is. It's an anti-inflammatory food choice. That's the packet I give my orthobiologic patients before we do their procedures. So.
And again, if you guys need help with this, we can help you with all these we have movement guides, we have, we have weight loss, anti-inflammatory, gut health, heart health. I mean, there's so many different
Mhm.
programs that we can help you guys with. So you guys just reach out and let us know.
Again, my focus is preventive care. So that's our goal is really to be proactive, and that's who I can really help. People who want to be proactive with their health. Like I said, I've got a handful of people in their early 20s all the way up to their late 50s who are coming in more for prevention because they're not in a lot of pain. They're active, healthy people, but they just want to stay that way. Like, hey, I don't want my condition to progress. For example, I see people with some mild spinal stenosis. This is a condition in the spine where you get narrowing. Well, we know from over 20 years of data from certain clinics in the US, one in Colorado in particular, Dr. Centeno and Dr. Schultz, they've been publishing data on spine orthobiologics, PRP, bone marrow for decades. And they've shown repeatedly that if you put these growth factors inside your joints in the spine, into the ligaments, this growth factors will prevent the overgrowth of those joints. So one hallmark of osteoarthritis in the spine is that the joints lose their cartilage, the bone rubs up against each other, and the bones thicken and grow. I don't know if you've seen people who have really bad knee arthritis. Their bones are just big and huge, and that's from the bone rubbing on bone, and it becomes swollen. The bone hypertrophies, and it can lead to spinal stenosis. And unfortunately, when it gets to that point, there's really no good solution. It turns into management. And so our goal is to prevent these things from happening. So by catching these things early. So
So I have a question.
mhm.
So a lot of the times when I'm talking to clients who are calling and want to schedule, they will make a comment about, well, I just have minor aches and pains. It's nothing that's significant. I don't think he probably wouldn't even need to see me. So the question is, when do you recommend somebody comes in?
When you have the minor joints and pains, like
Okay.
that's if you're interested in prevention, right?
Okay.
So people like to wait. They like to wait till, oh my gosh, I got shooting pain down my leg and I can't walk, right? Well, that's going to be harder to manage. It just is. I mean, that's where maybe modern pain management or traditional pain management is going to come into play first, where we do the steroid shot to calm down the pain and then we work on prevention. I have a handful of people that I have to do that with. A lot of people know I do these orthobiologic procedures, not only in the joints and ligaments and tendons, but also in the spine. And so they'll come to me and say, hey, look, I saw a traditional pain management doc. They wanted to do steroids and ablations, and I really don't want to go down that route. And I'll assess where they are in terms of their pain and their functionality. And if they're significantly debilitated, well, then I think the modern medicine approach with epidural steroid injections or ablations or whatever is indicated may be the better way to go to get them out of pain so they can do the physical therapy, move their body, rehabilitate, and then months later we'll augment with the PRP or the bone marrow. And so what that can do is help actually get to the underlying cause, right? So some people have a herniated disc touching a nerve, and people will say that is the underlying cause. I'm like, no, that's a consequence of a series of biomechanical actions and disruptions in the ligamentous structures and the muscles that led to that. So that's the underlying cause, and that's where the physical therapy comes into play. And it's probably lifestyle choices too, the food you eat, your body movements, all of that. So, my focus in my practice has been regenerative medicine, and this works to actually help treat the underlying cause. We've learned that, with PRP, platelet-rich plasma, you put in a tendon that's torn, if you have the right platelet dose, which is a whole other topic of conversation, but when you get the dosing right, you can actually see those tendons repair themselves. So we have the ability to do that. unless it's surgical, of course, and you need surgery. But if it's non-surgical, these regenerative therapies can be a good option. We're not necessarily seeing cartilage regenerate, but what we are seeing is cartilage maintain. So again, that's why I put it in my right knee. I have no cartilage loss in my right knee. I have no pain, but I want to keep it that way. Again, the choices we make today are going to affect us decades down the line. So it's about prevention and it's about optimization. So with regenerative medicine, we can treat joint pain, anywhere from mild to moderate with PRP. More advanced joint pain, we can use bone marrow aspirate concentration. So that's where I actually put a needle in the back of your pelvis or iliac crest. I do this under X-ray. I take out your bone marrow stem cells, the growth factors. There's incredible anti-inflammatory proteins there. Concentrate those, and I can put those back into your diseased joint.
And this is all done under sedation, so you're comfortable,
Absolutely.
relaxed.
Absolutely.
It's not like
I am a board certified anesthesiologist. I have a sedation nurse in the room with me. So we
you have a
give you
whole team.
sedation. We've got a whole team of people. So
Mhm.
we make this, we try to create the best experience and most pleasant experience possible. Most people, when they get to recovery, they don't even remember having it done. So
Mhm.
it's usually their family member who tells them, oh yeah, you had a little bit of discomfort afterwards. So like, really? I don't remember anything about that. So it's kind of nice. So the whole experience tends to be relatively pleasant for most people. So, but it can also reduce dependence upon medication. I still see people who are taking Advil every day, and that's so bad for you. If you read the bottle, it's not meant to be taken for more than 1 to 2 weeks at most. So it's not a good solution.
Long
Um,
term.
Long term, yeah, it's
Mhm.
causing kidney damage. It increases your risk of heart attack, a stroke, bleeding ulcers. So there are side effects that are associated with these medications. And we know from some recent studies, well, published within the last 10 years, that these anti-inflammatory drugs actually accelerate the process. So can make your condition worse.
We did have a question in the chat about what is the post-care like after somebody gets regenerative medicine.
Oh, so it just depends on what body part we're treating. So I have a protocol that usually involves hyperbaric oxygen therapy. So this is where you go into a hyperbaric oxygen tank. It's 100% oxygen under pressure that has a profound anti-inflammatory effect, so it can reduce any of the post-procedural discomfort. It's actually a healthy anti-inflammatory effect. It doesn't get rid of the inflammation like you would with anti-inflammatory drugs, but it reduces inflammation more naturally. And then it also stimulates the release of stem cells from your bone marrow, gets those into circulation. Those get attracted to wherever area we treated because of the growth factors in the platelet-rich plasma. Um, I have you rest for about 3 to 5 days afterwards. So take it easy, no working out, just gentle mobility because if I'm doing ligament structures, like if we're doing a knee, I'm doing inside the knee, sometimes the meniscus, sometimes the ligaments around the knee or even inside the knee. When we do these treatments, there's a little bit of laxity that can happen there. So if you overdo it, you could actually injure yourself. So typically I'll brace the area if I can. And then we'll have you brace it for anywhere from 1 to 2 weeks, depending on, your post-procedure discomfort. Then I have you start physical therapy. Physical therapy is usually 2 to 3 times per week for the next 6 to 8 weeks, and then continue the anti-inflammatory diet and really support your body's healing. And that's through mindset, meditation, movement, and diet. Those are the big things there. So we've talked a lot about this already with the regenerative medicine, using your body's own healing ability. I take your blood from your one of your veins or bone marrow. It's the same process for either one. One comes from your vein, a simple IV stick. The other one's a little more involved where under X-ray I go or ultrasound I go into the iliac crest, the back of the the pelvis. And then under anesthesia, it's conscious sedation in the office. I go in there and I just take the cells directly out of the bone marrow there, spin them, concentrate them, and then put those back into the body parts that we're trying to help.
Maybe you could break down the difference between PRP and bone marrow and what each are doing
Yeah.
and what they're effective at treating.
Yeah. So you can think of PRP works as an anti-inflammatory. I mean, that's really where it shines. It has an anti-inflammatory effect. In some tissues, it can actually repair ligaments and can repair tendons. It's really good from mild to moderate disease. Okay. So when you get to the more advanced stages, that's where the bone marrow would come into play. So bone marrow actually has cells, MSCs, which used to be called medicinal, or sorry, we used to be called mesenchymal stem cells, but they're now called medicinal signaling cells. Dr. Arnie Kaplan, he's the godfather of stem cell science. He studied these cells and really understood them. They're not stem cells like not the same stem cells you would get from an umbilical cord or from a placenta.
These are your own
These are your
bodies.
own body
Yeah.
stem cells, but they are actually committed progenitor cells. So they're not truly stem cells. What they have the ability to do is turn into cartilage or even bone tissue or tendons or ligaments. So what they can do is they can help repair those areas. So it's
And that's
more
coming from PRP.
that's from bone marrow.
Oh, bone marrow,
Yeah,
sorry.
so bone marrow is more for advanced cases. It tends to last longer, tends to work better. So I give people the option for the most part. I mean, there's a price difference too. So if someone's mild to moderate, usually PRP is just fine. If they're more advanced, then I'm going to tell them, look, if you really want to get more bang for your buck and you really want to get years of potential benefit, then we need to really look into doing the bone marrow. It's full of a protein called IRAP, interleukin receptor antagonist protein. This is the magic sauce that Kobe Bryant got when he went to Germany to get his joints treated. They isolate that particular protein from the plasma. When we do PRP, I do the same thing, but it's at a smaller concentration than it is in your bone marrow. Your bone marrow has a lot of that particular protein that's profoundly anti-inflammatory.
And what
So.
I like is that it's your own
It's
body.
your own body.
Yeah.
Yep, exactly.
Yeah.
And I tell people that's why the pre-procedure protocol is so incredibly important. I give you a 45-page packet with recipes, grocery lists, and everything you need to do to make healthy plasma and keep your body healthy. So when we take this stuff out of you, it's gonna be as optimal as possible.
What about what's the difference between, because more and more people are starting to do regenerative medicine, PRP, bone marrow.
Mhm.
What do people when they're deciding on this treatment, what do they need to look for when, you know,
So it's important to have a physician that's actually trained in this stuff. So there are a lot of people out there, and my colleagues out there who unfortunately are just dabbling. They don't know the science behind it. They haven't done the research. They don't understand the concept of platelet dosing. They're not necessarily using image guidance. I've been studying this since 2017. There are people who've been studying it a lot longer, obviously, than I have, but I feel like I've been in a fellowship training in this field for almost 8 years now. And I've been fortunate to, meet some of my mentors and become friends with them. And I've trained with the world's experts in these areas. I'm still training with them. I'm always learning. I'm always reading. You want someone who's up and up on this information because it's constantly evolving. I can tell you from 2021 to 2025, my practice has changed, even with how I do PRP. We've had level one studies that showed that, hey, listen, for a positive response in a knee, you need to get to 10 billion platelets. How do you do that? Well, you should ask your doctor that. If they can't explain it to you and they don't understand it, then they're probably not the right ones. We know we need to have a minimum blood draw to get to a certain level of platelets. A lot of people are still doing test tube PRP, and that may be good for your face, for the P shot or the O shot, those kind of things. But if you're going to treat joints, you're going to treat tendons, you're going to treat ligaments, you're going to treat spine, then you really have to get a higher dose of platelets. For example, when I do a more diseased joint, I'm taking 240 cc's of blood. So that's about a quarter of a liter. For a spine case, I'm taking 480 cc's of blood. That's almost half a liter of blood, but that's how we get the volume that we need and the platelet concentration that we need because it's really important to have the appropriate concentration of these factors so you have a therapeutic response. So you want to ask your doctor about that. Explain to me platelet dosing and where you take the blood and how you spin it and how much blood are you taking, right?
Mhm.
That's really important. And are you using image guidance? Are you using X-ray or using ultrasound? And have you done training in both of those? That's really important too. Precision is everything, especially when you're delivering these biologics. I did a little post about this earlier this week,
Mhm.
but doing these procedures without X-ray or without ultrasound is like throwing darts in the dark. You really need to know where that needle tip is, right? And the only way you can do that is by seeing it. So when I'm doing an ultrasound rotator cuff, for example, I'll see the rotator cuff, I'll see the tendon I want to tear, or that's torn or that's injured, and I'll watch my needle go right into the defect, and I'll put the platelets right there, or the growth factors, whatever it is, right there, because that's where you want them to be. Um, you know, close enough isn't good enough, especially when you're paying your hard-earned cash for this,
Yeah.
and you really want to have a good outcome. So, image guidance, and then understanding the concept of platelet dosing for bone marrow is understanding extraction techniques, because there are several different ways to get the bone marrow out, and there are several techniques, and some are better than others. And we've learned that through studies that have come out of Europe, and then also the people I've trained with here in the US who've shown me, hey, look, here's the studies, here's why we do what we do. And that's incredibly important.
So we're getting close to the hour mark. We want to be mindful of everybody's time because, you guys probably had a long day. But give us some idea of some of the patients. I mean, you've done thousands of patients. So
Yeah,
give us some idea of, the results that people are getting. Maybe you can give us a percentage of,
sure.
and you're collecting all of this data
Mhm.
through a platform where patients are actually going in and providing responses to how they're recovering after treatment. So, what is the percentage of patients that are actually having a positive effect from these treatments?
Right. So we have something called data biologics. This is a national registry of physicians who specialize in these fields. That's another thing you want to ask your doctor about. Are they recording their outcomes? Are they tracking their data? Or are they just saying, oh, yeah, I got a 50% response rate or 80% response rate? Well, I can tell you real world data. I've been tracking my outcomes over the last almost 2 years now, and we're at about an 87% satisfaction rate, meaning 87% of the patients I've taken care of are really happy with their outcomes, right?
And I would say that's a little bit higher just because
Not everyone's
not
following up.
everybody is following
Exactly.
up with their results.
Right.
And sometimes they drop off at like the 3 month mark, and we're actually talking to these patients at like
T-
6 months
Yeah.
and they're like pain free.
Some are, yeah,
Yeah.
some are. With these procedures, though, I tell people like this isn't a quick fix with these biologic treatments. It can take on average anywhere from 6 to 12 weeks before you really turn the corner, and then 3 to 6 months before you peak. I tell people about 6 months is where you'll know where you are. And that's when we decide if we need to do another therapy or, but I've seen some people, a lot of my patients have heard a story. I got to take care of this really nice woman. She texted me, and we at the 8 month mark, we were talking about repeating her spine PRP. I did her in January 2023. I treated her in January 2023, and then 6 months, really not much ground. In August, she reached out to me. She's like, "Hey, look, I'm just not getting where I wanted to get to. Maybe 10-15% relief at best." She's like, "I'd really like to schedule a second round." I'm like, "Okay." She's like, "I got some traveling coming up. Let me get back to you." I didn't hear from her again till May of 2024, and she said, "Hey, I forgot to reach out to you. I saw your ad in the So Scottsdale magazine, and it reminded me to give you an update." She's like, "At 8 months, I really didn't have much progress." She's like, "But after that, I traveled," and she's like, "My back really gained ground." So as of May of 2024, so a year and several months afterwards, she's like, "My back is barely an issue now." So it can just take time. So that's one extreme. I've got other people literally within a few weeks, they're feeling better. I've done some spine cases where they come in with really bad sciatic pain. In a few weeks, they're like, my sciatic is gone. And I've got one guy I just saw this week. We did his procedure 2 years ago. His sciatic pain has never come back. So,
It's great.
mhm.
We went over that.
Yeah. Prevention is about prevention. The choices you make today are really going to form the person you are 10 to 15 to 20 years from now. So
Yeah.
it's all about foundational health and prevention.
So if any of you want to, one thing that we offer at the clinic is a free pain assessment call. So this is where you meet with me and you go over your symptoms and we kind of talk about what your goals are and figure out if coming to the clinic to see Dr. Goyle in person is something that would benefit you. So if you want to chat more, as far as, just individualized care, I'm going to, as soon as we get into our question and answers, I'm going to put a link in the chat for our website, and then also for our call schedule, and you can book a call with me at any time, and we can go over, whatever you need. But at this point, we're going to open it up for question
Right.
and answers. You can, if you have your little emoji, you can raise your hand. And then what we'll do is we will call on you, and then you can ask Dr. Goyle whatever you need. Let me see here. I'm just gonna stop the share. Sorry, guys. Okay.
Can we unmute everyone?
Well, we'll unmute
Oh,
them
okay.
when they raise their hand.
Got it.
So just go ahead, and you can, if you don't feel like raising your hand, you can also just put it in the chat and we'll go
Yeah.
through
So
everything.
Rosemary asked, will this work with the hip? Yes, I do. I work with every joint in the body. So from fingers all the way up the spine, down the spine, hips, knees, ankles, toes, pretty much all of it. And then thanks for the update, Rob. That's fantastic. What else? There was some before there. Yeah. Hang on.
Giving blood.
Hey, now it's this one here. Suggestion for polymyositis. So that is a chronic inflammatory state of your muscles. The anti-inflammatory diet, I think, is really incredibly important. In addition to that, the right supplements, anti-inflammatory supplements, I think would be beneficial. And then also consider hyperbaric oxygen therapy. Um, Again, that's where you go into an oxygen tank. It's 100%, it's 100% oxygen under pressure. That can have a profound anti-inflammatory effect also. There's also a very almost homeopathic medication called low-dose naltrexone. That's a microdose of the full dose of naltrexone, which is the drugs used to treat opioid addiction, heroin addiction, and alcoholism. Well, at microdoses, it can have a profound anti-inflammatory effect in the body. Here, this is a good question about cacao powder. Yes, there is a study that has shown that 100% cacao actually stimulates our own body stem cell production. So that's one thing that's not in my anti-inflammatory prep yet, but I think that we're going to add it in there.
Yeah.
But it's got to be the 100% cacao. So I just started eating 95% dark chocolate, and I do it a little bit every day just because of that effect. I mean, that's a proven, I mean, the study that came out was pretty profound. And if you're interested in actually reading the study, I can send a link to it, or you can just Google it. It's pretty remarkable. Um, Failed low back surgery syndrome. I see a lot of low back surgery syndrome. I mean, I probably made a whole career out of treating that with epidural steroid injections and spinal cord stimulators, right? But now I'm seeing people who are like, hey, listen, I've had a surgery. It worked for 10 years. Now things around the area that were treated are starting to fall apart. So what can I do? And that's where some of these biologic therapies may come into play. Again, I would say start with a foundation of food and then get into a right program of movement. Um, One of our good friends, Parker, is on the call. He's an extraordinary movement specialist, personal trainer. But he's someone you could reach out to who would be really beneficial for getting you started in that direction. And then, that can be really beneficial as well. But yeah, failed back surgery syndrome doesn't have to control your life. You know, yeah, I've talked to some surgeons who are pretty forward thinking, and they're very they'll talk most people out of surgery because they know that they can fix one area, but it's going to create some kind of problem somewhere else. Because once that anatomy is altered, the rest of the body has to compensate for that. So, what else we got?
I think that's it.
Any other questions, guys?
I
Can I
put
ask a
the
question?
link in
The
the
chat.
chat. So I put a link because I know we went over a lot. I put a link to our 15-minute pain assessment call. So if anybody wants to hop on a call, I also put our website if you want to learn some more, and then I put Dr. Goyle's Instagram as well as mine. If you want to get some anti-inflammatory food ideas.
And then if you just want to see what we're up to on a daily basis, you'll get to see a lot of
A lot of
posts of our
dogs.
dogs. Yeah, exactly. So tricompartmental osteoarthritis, grade 4. Can I help? Possibly. Possibly. I need to see you, evaluate you. Because grade 4 doesn't necessarily mean dysfunction, right? Like I said, I've got grade 4 in my left knee, but I can hike PS to a peak. I can squat. I can run, right? So it really depends on the individual person. But typically for well, I take that back. I was going to say typically for grade 4, I do bone marrow, but I've only ever done PRP in my knee, and it's responded well. It did take 4 treatments to get to where I was 100% pain free for almost 2 years, though. So the first 3 injections I did got me better. I'd say 70 to 80% better, but it was really the fourth one where it really took me to the next level. So. Uh, Frankincense and myrrh, good question. I like incense. I burn it. I know it has a calming effect in the body. I know that I read a study. This is probably back when I was in medical school or college, where they were studying like Catholic priests or monks, and I forget exactly who it was, but they were burning frankincense and myrrh, and they found that it had an antidepressant effect. So, hey, listen, if burning some incense or some essential oils will have an antidepressant effect, that's also going to put you in a state of health. So, big fan. I just can't quote the study directly. I don't know if there's been any more research done on that, but I think that if you find it to be calming and beneficial, great. That's going to increase your parasympathetic nervous tone, nervous system, and promote more health and healing. Low back fusions, I see a lot of people with fusions. What I typically do for that is if we're going to do a PRP or a bone marrow treatment, I inject usually above and below the fusion to really give those areas support. Because what happens when you're fused is the level above, level below. That's the only area you have motion. They can become hypermobile. They can accelerate degeneration. The ligaments get loose and lax, and then you're buying yourself more fusions. Gel injection. So this is going to be hyaluronic acid. I think that's way better than steroids. We know that hyaluronic acid does not destroy the tissue. What it does is it lubricates the joint. We know it doesn't prevent the breakdown of tissue, but it also doesn't cause a breakdown of tissue. And it can be really effective. It can last anywhere from 6 months to a year for some people, but typically more around 6 months. So, and I got people on maintenance just with the gels just to keep them going, and we can maintain. Of course, I would recommend the best studies have shown that the trifecta, the gel injections, hyaluronic acid, combined with PRP, combined with something called protein concentrate, that's where we see the best results.
Great. So we hope you guys liked this conversation. Please give us some feedback and let us know. We're planning on doing this regularly.
At least once a month, maybe
Yeah.
twice a month. Yeah.
And each time we're gonna do a different topic. So tonight was osteoarthritis. If you guys have suggestions, you have our email. You can send us an email,
Yeah.
and we'd love to know what you guys want to learn about and what you want more information on. So we can kind of, you know, design them in that way.
Yeah, we're open to suggestions. I mean, we can do one on back pain if you want to, or whatever you want to learn about that's
Mhm.
in the realm of holistic pain management. That's really what we want to explore with you.
Yeah. All right, guys. Like I said, we recorded this whole conversation, so I'm gonna send it to everybody tomorrow in email. Um, and if you have any questions, just let us know. Otherwise, we will let you go enjoy your night.
Yeah, thanks for
And
sticking around.
thanks
Yeah,
for joining.
almost an
Thanks for
hour and a half.
asking questions.
Yeah,
It's a lot of fun to do
yeah,
this.
great.
Thanks for
Have a
having
great
us.
night, everyone.
Thank you.
Hey, good to
Bye,
see you,
Rob.
Rob. Yep, take care, buddy.
Thank you.
Yep, you're
Okay.
welcome.
Bye.